Welcome, everyone. Super excited to have the three of you here on this conversation about fall prevention. We are in September, which is National Fall Prevention Month. And joining me today is Carrie Rogers. She's a PT and our mentor coordinator for Upstream Rehab based out of Atlanta, Georgia. We have Jeff Whitaker, who is a physical therapist. He is both a clinic director with our organization and also a regional clinical excellence coordinator. So he gets the fun job of focusing all about clinical excellence, and he's down in Texas. And then we have Miss Ellie Beach also joining us, physical therapist and soon to be resident, which is really exciting, in North Carolina. I just want to kick off with asking you all, what do you commonly think of as a fall as a physical therapist versus what patients think of as a fall, and what is it that you want them to know about when they should come visit us?
I can start. I think that from what I've seen, and understandably, when we think of our patients and we think of falling, they may not be concerned until they've actually had in an incident where they've fully gone to the ground, or where perhaps they have unfortunately experienced some form of an injury. When really it's important, what I would want patients to know is that if they're seeing a decline in their function, specifically around the realm of feeling safe moving around, if they're losing their balance, stumbling, tripping, holding onto walls or furniture while walking, we can address that. And that is arguably a fall, or at least a strong predictor and precursor to falling. And we really want to avoid major falls. We want to avoid injury. And as physical therapists, we want to be able to assess you and potentially treat you to enhance your function and to make sure that you're safe, and to overall improve your quality of life. And certainly the earlier that we can do those things, the better, so that your general function and safety doesn't continue to decline.
I was going to say, just going off of that, I tell people once it starts to get to where you're kind of second guessing walking out to your mailbox or walking through your garden, or when you get up in the middle of the night and you're trying to grab onto your bed rail, onto your dresser to make sure that you're steadying yourself, you definitely need to be coming into therapy to kind of get screened for your risk for falls. It's always better to come in before a fall, because the highest predictor of having a fall is having a previous fall. So definitely coming in once you start to you start second guessing those movements of, ooh, do I really need to do that right now? Or maybe I'm going to wait for my son to come do that for me.
And then I tell people this all the time, that generally as people age, their balance could deteriorate, but I love telling people that balance is highly trainable. If you get the right stimulus, your balance will improve. And that's really inspiring to people to know that, hey, when I'm 67, maybe I had a fall, but when I'm 70, my balance could be better than it was 3 years ago, which is really, really cool to tell people and to see the change in people when that happens.
It's a really great point. When you think about getting access or giving access to people in our communities, if they're concerned about falls, does that mean they're coming in for a full evaluation? Do they have other mechanisms to determine if they need to be seen in PT? What does that look like?
We definitely have mechanisms for screening our patients and stratifying fall risk. So again, to echo what everyone said, but what Ellie said about as soon as it starts or as soon as you're losing confidence, that's a great time to contact one of our clinics. And we can get you in for just a shorter fall risk evaluation. So not necessarily at that point a full evaluation, but do some standardized tests, having a conversation with you, looking at things like your blood pressure, and determining if you are in fact low risk, moderate risk, or high risk for falls. And based on our findings, we can determine the best course of action for you. So whether that be following up with us in a year, or contacting us if you feel like there's you have greater concerns in the future, but it initiates that conversation, or maybe looking to get you involved in like a community class just for generalized strength, or something to be a little bit more active, or whether we need to look at an actual full evaluation and course of physical therapy if perhaps you fall more in that moderate or high fall risk. So again, I would just summarize by saying that we do have methods in place where we can just screen an individual and make sure that we're starting them on that right path for best care.
That's great. When you guys do a screen, or someone maybe just gets sent to you already, or someone shows up and knowing like, hey, I think I have this issue, and they're going to do some sort of fall prevention programming, what does therapy look like for these individuals?
You really want to know what's important to them. And so are there specific activities or goals or things that they want to be doing? And we build that into the treatment plan. I always like educating folks on the 3 different components of your balance system. And so you can assess the different components and bias your treatment to improve specific areas for each individual patient in front of you. And I think by doing that, you're able to help people just overcome their weaknesses and live a fulfilling life.
Yeah, I'm a big fan of that question because I feel like a lot of people think there's only one way to go about a balance program. It's like, oh, my neighbor did this and they just made her stand on one leg or whatever. But there's so many components to balance, like what Jeff was saying, that you have a lot of different systems that you can work with. And it's really about what the person's goals are. You know, the goal of being able to walk through your house is a lot different than your goal of being able to walk through your garden. So we really take a more personalized approach to it, and trying to find what is it that you want to do. Are you trying to be able to go up and down curbs without having to hesitate or grab onto somebody around you? So it's a very personalized approach, and it doesn't look the same for everybody.
When you've both mentioned systems, and so looking at other systems, can you identify, or can you speak a little bit to like what are those systems that you're considering looking at, whether that's screening for or actually treating when we think of people at risk for falls?
So the 3 systems that play a huge role in your overall balance are your somatosensory system, or your feet feeling the ground underneath you, or any extremity, your hand feeling the cane, which is feeling the ground. Then you have your vestibular system, which is your inner ear, which will give your brain feedback on rotational movements and acceleration. And then you have your visual system, just your eyes receiving feedback on the world around you. And so it's really interesting. You know, you hear stories of people getting up in the middle of the night and falling when they have to go to the bathroom. And then you think about, as a therapist, I'm thinking, well, all of a sudden they're operating on 2/3 of their balance system because it's dark and they can't see. And so you can train and improve the somatosensory and the vestibular system to help with that common activity that they're potentially doing every night.
I could just add to that as well. So we do have those 3 main systems that sort of generally play into your equilibrium, balance, steadiness, however, whatever term we want to use. But there's also so many other components of holistic care for a patient that we can provide education on, or that we can investigate a little bit more. So when we think about things like, are you wearing proper footwear? Pelvic health may play into this as well. If you're experiencing incontinence and having to get up 10 times a night, and sort of as Jeff alluded to, it tends to be dark in the middle of the night, or you're not as awake. So does that need to be addressed? If a patient is experiencing frequent UTIs, that can create some disorientation and some other symptoms that can potentially make somebody at risk for falls. And then we know that there's personal factors like loneliness or depression that can also maybe create changes in balance, or changes in overall quality of life and functional capacity. And Jeff spoke to this a bit, but vision is one of our systems for balance, but also maybe hearing, or cognition, or altered mental status. So there's really from every angle in physical therapy, we're trained to at least identify needs or screen different needs. We may need to recommend referral to an optometrist or to someone who can better assess you. But we can screen all of those areas and educate patients in all of those areas to make sure that they're really being looked at as a whole person.
Thinking about all of the different things that we can address and that we might be looking for, are there any things that you would want a patient to know, like something simple or easy that they could do right now, if someone's listening to this, that they could do to help reduce their fall risk at home? Are there any strategies that they could do today?
Ooh, this is something I think about often, and this is kind of like in the the public health world. Like, if I was able to make one change in how people age or approach their aging, I would, and I invite my patients to do this sometimes. It's hard to follow up on it, but every year on your birthday, if I had someone who's 65 or older, or even younger than that, do a 5-time sit to stand test. Stand up and sit down 5 times and time it and see how long it takes you. And then stand on one leg and see how long you can balance on one leg. And if you did that every year, you would be able to track change over time, because people will say, well, my balance isn't as good. Well, you can't quantify that. Well, when did this start? How long has this been going on? Is it acute? Has it been going on for 10 years? We don't know. But if people would take measurables and do it every year, then you'd be able to say, hey, last year I could do this for 32 seconds, and this year I can only do it for 15, and let that be your impetus to get care, to change it so that you don't have a fall in the future and a hip fracture or a concussion or a head injury. And so that's something that I think about all the time, that I think would really improve global health in our country and in the world.
Yeah, I'll echo that. Maybe this doesn't directly speak to what they can do as in like an activity, but I just really like what Jeff said. And I think that being an advocate for yourself, or I guess recognizing that just because you're aging doesn't mean that you necessarily have to restrict your activity, or like that falls are inevitable. Because again, there's so many things we can address, from your strength of your legs and your arms, to some of those tactile proprioceptive activities of adapting to various surfaces or feeling steady on your feet, to potentially a vestibular or inner ear disequilibrium problem. That I do think that oftentimes, unfortunately, we hear from people said, oh, I don't get around as well because I'm older, or, well, I know that as you get older, your balance is just going to go. So I just do want to echo that. And I think that sort of screening yourself a little bit is a great way to do it, but just recognize that there is help. And as Jeff mentioned earlier, if you work on something, it will improve. So that don't just associate fall risk or decreased balance. It doesn't have to necessarily go hand in hand with aging. So that is just something I want patients to know and to be aware of, and to care for themselves, and to get in for a fall risk assessment and get the appropriate care.
And kind of to go off of that just a little bit, is if you're a person who, you're getting up there, and again, like kind of like what Carrie said, you just think it's going to be inevitable, stay active. Sitting and being sedentary, not doing a lot of activity is what's going to take that balance from you very quickly. It zaps your strength. It kind of messes with that equilibrium. So just stay active. Find a walking program that you can do, or go to your local senior center and, just participate in a couple of those classes a week. So it doesn't have to be anything big. Walking around your neighborhood is a great way to just kind of keep everything moving. That's the best way to kind of help avoid, that strength loss. And then, of course, as we talked about, if you start to see kind of some of these signs, come in and get screened. We are more than happy to see anybody who comes in, because we absolutely want to prevent that first fall before it takes place.
Are there any other strategies that people can do to maybe modify, whether that's something they're doing or something around their house, that increases their safety when they're navigating their house?
Yeah, so like the things that we're trained to look at as physical therapists are Throw rugs can be dangerous if people aren't picking up their feet or they don't see it. They can easily get tripped up on that. Cords. I got 3 little kids in my house, but most seniors probably don't. And there's toys everywhere, and so there's fall risk at my house. And so the night lights are super helpful.
Furniture walking is also a big one. So that's where you're grabbing onto furniture as you move through rooms. You never know when something's going to shift on you, when something has been moved. And so if you don't have a nightlight and you're reaching out for something, you could very easily fall if it moves under you or if it's no longer there. So I always tell people, if you're at that stage, then it's definitely time to start looking at using a cane or the walker inside the home to help prevent that fall, because that is a very dangerous thing to do. The cane and the walker are much, much more predictable.
Well, listen, I really appreciate that. I think those are my last questions for you all. This was really fantastic. I appreciate your voices on this conversation. I'm looking forward to hosting some more of these and talking about how we can really serve our communities. I'll close with anybody that feels like they do need a screen. You can reach out to any of our clinics that can offer free screens. They're 15 minutes in length. We also have an easy button on our website to invite you for a free screen. And many of the communities we serve, we also host fall screens at a variety of community events. So whether that is any of our over 50 expos, any of our other health-based expos, we do host those as well. So take a look at what's coming in your town. Carrie, Jeff, and Ellie, again, thank you so much for joining me.